I'm very fortunate to be a physician, to be a neurosurgeon at Mayo Clinic. At Mayo Clinic, we're able to practice medicine the way that it should be practiced, focusing on each patient, helping that individual patient, and able to rely on many thousands of physicians within our practice that we can turn to for any variety of rare diseases or ailments. Mayo Clinic is really a unique place in terms of our ability to deliver great care at a very high level in a consistent way. My primary objective is that every patient can live as best as possible the type of life that they would like to see. So at Mayo Clinic, we tend to treat very rare conditions. And so patients come from all over the world, often with rare, difficult to treat conditions that people in their local areas may not be as comfortable treating. But we tend to do those very rare things very commonly. Miss Wanandi's case is an interesting one. Her family and her husband have been coming to Mayo Clinic for many decades. Miss Wanandi was first seen for an executive physical.
We always come to Mayo during the summertime since I think maybe about 25 years ago. So this is part of the yearly checkup actually. Yeah. And I don't realize that this is actually maybe the sign of that I have the spinal stenosis.
She saw me for very debilitating, severe back pain.
The first time I met Dr. Biden, he was so helpful. I feel so comfortable, confident with him. He explained everything to the families, yeah, just to let them know what is going on, what I'm suffering now. I asked Dr. Biden whether I can do it next year, the surgery. He said no. Cannot wait too long. I have to do it as soon as I can. Because my age, I think my sickness is a bit serious. He knows better.
Miss Wanandi underwent surgery and has really recovered quite nicely and has been able to do a lot more things than what she was able to do before, and has been able to get back to her nursery with young children and also to her organization that takes care of paralyzed children back home in Indonesia.
Personally, I'm very impressed of the Mayo Clinic services.
The people in Mayo from every level, not only for the specialists, the consultants, the doctors, including the nurses that has attended to Joshua. They were superb, outstanding, amazing. They have done an amazing job on Joshua.
Very excellent services. The standard operating procedure here is very excellent, it's clear. You feel safe, you feel being treated like really patient-oriented service.
They never work by themselves, making decisions about the patient's problem, but they always do in a team.
The approach is very integrative and collaborative or multidisciplinary. In Mayo, they have a very specific specialist doctor.
At Mayo Clinic, we have a team-based approach. So we believe in a multidisciplinary, team-based approach so that we can deliver the right care.
People ask me, is it difficult to become a Mayo patient? And I said no. With the help of the International Representative Office, we could do it.
There's something called IROs, or International Referral Offices. Mayo Clinic has those throughout the world.
I think it will help greatly for the Indonesian patient.
We help patients secure appointments at Mayo Clinic, working with International Appointment Office, providing personal, expedite service to established patients and prospective patients, including helping them with estimates charges, payments, medical reports needed from Mayo Clinic. If you're thinking about visiting Mayo Clinic, we will share more information that can help you make the decision works best for you. If you are looking into making an appointment with us, our representative office can help you guide through the process and answer any questions you have. Before you travel to our facility, we can help you navigate the travel plans, lodging, and translation services.
The IRO in Jakarta will give more Indonesian patients easier access to Mayo Clinic and experience a wonderful quality of care.
When somebody wants a certain level of activity so that they can go about, be with their family, be with their children, their grandchildren, and also help their broader community as Ms. Wanandi does, it's very important that we do everything that we possibly can to get them back to that. And I'm very glad to see that in Ms. Winandi's case, we were able to do that.
To be healthy gives me quality of life, so I can help more people and increase their quality of life too.
At Mayo Clinic,
The needs of the patient come first.
Di Mayo Clinic, kami mengutamakan kebutuhan pasien.